of the reasons that Bebashi had to come into being was because those organizations that existed to provide public health education for minority people didn't, couldn't, haven't, won't provide education for the minority community. Today I had to really study hard as to what I was going to say. And one of the things I thought I better define was, what is a minority?
Tell them about.
Webster's dictionary says that a minority is the smaller, inferior part compared to the unimportant in size and degree. That we are a part of a population different from others in some characteristics and are often subject to differential treatment. As in other health issues, black people are also being discriminated against, even within the gay community, when it comes to being educated about AIDS.
Right there.
We have worked very diligently in Bebashi with the Philadelphia AIDS Task Force. We were committed to participating and networking with a variety of organizations whose intent was to provide minority education. When I started with the task force 2.5 years ago, the statistics were even. In the white community, there was 84 cases. In fact, this time last year. And in the black community, there were 81 cases, and everybody was committed. Resources were committed, and we fought, and we went on public education trips to present information about the disease that was affecting the people. And then the numbers began to change. And last November, Bebashi, along with other groups, including the Philadelphia AIDS Task Force, said it's time to do something about the changes in the numbers, which were representing an increase in the number of cases among blacks particularly, and what has become now a problem in the Hispanic community. In January of this year in Philadelphia, there were 231 cases of AIDS confirmed by the Philadelphia Health Department. At that time, 112 cases, half the number, were among blacks. 13 were among Hispanics. The other day I received the report from the health department that said as effective July 31st, there were 338 confirmed cases of AIDS in Philadelphia, and 168 of them are now black. 148 are among whites. 21 now among Hispanics, and we just got a minority educator coordinator for the Philadelphia AIDS Task Force. Now, I know some of you may be offended by the fact that I would say anything against the Philadelphia AIDS Task Force. But I think what's important to understand is that's where the resources are, and our people, minority, those differing comparatively to the population, have the right to be educated, have the right to have resources committed, have the right to stand here with you and say that we are dying from this disease and you're making it our disease. If in your presentations to your community you don't remember the Hispanics and you don't remember the blacks, I guarantee you we will be there to haunt you for it. Bebashi is committed to providing the minority services that need to exist for the minority community. In your paper, you'll see two important features I would like you to cast your eyes upon. One of them is the picture of those that we are marching for. You will find one black, could be Hispanic individual on that paper. What it really should be is one white man, one white woman, and the rest of them ought to be black or Hispanic. I want you to be angry with me.
Yes.
I want you to be upset.
Yes.
And then I'd like you to turn that energy to committing yourselves to seeing that minority people obtain the same treatment, the same empowerment to suffer from this disease, to get away from it, to have health care as you have. The second item I'd like you to look at is where it says that I am the Vice President of the Philadelphia Community Health Alternatives. I was duly elected to that position with the whole intent that I might have some impact, if you prefer, pardon me for having to use that acronym, impact. That's the minority perspective that is supposed to affect the policies of the task force. But because after this time period, 2.5 years of trying to impact the task force with a minority perspective, I resigned. I have resigned. Bebashi is out there. Those who are interested in comfort care, because that's what we call our buddies, there are black PWAs who need to have someone who understands their cultural as well as their physical needs. That's the difference that Triumph brought. We have a friend. We need some friends. I would like to close by saying that it is not my intent to pretend that all of this wonderful, compassionate feeling doesn't mean something. We need that. We need to hold hands, and we need to fight and struggle together. But I want you to remember that while you're fighting, there are those who are different from you who need to have a voice in how things are done. And we would like to network with you. And one of the things that I want to do is to remind you that through my candle, that there are black people dying in this city from AIDS because they are ignorant, because they do not recognize that it is not just a white gay disease. And I ask your help and your support in trying to provide that information to that community. Thank you.
Thank you,
Mother,
Lorraine.
I'll let you take it away.
Greetings and salutations. Thank you for coming out. We are going to have an amazing conversation. My name is MuthaKnows from Power 99, the Rise and Grind Morning Show. Salute to Philly Black Pride for an amazing weekend for the community. You guys have laid it out like a Persian rug, and I am very thankful to you. I have two beautiful women sitting next to me, and we're going to break this up into chapters. We're going to start with part one, the early days. Dr. Rashidah's founding vision. Dr. Rashidah, take us back to 1985. What were you witnessing in Philly's Black and LGBTQ plus communities that moved you to create Bebashi?
It was a very difficult time. People were dying so very quickly, but I was a nurse in one of the major medical centers here in Philadelphia, and the challenge was watching gay white men come in, get some kind of medication, some kind of support, and living for 2, 3, 4 years in the beginning. But if you were black and you came in with any kind of infection, your death sentence was coming in 9 months. And it was very painful. The very first young man I took care of was only 21 years old. And the way he was treated was what was so difficult for me. He actually is the person that I said, this is never going to happen in front of me again. He came in because, as he said, I can't pee. And so he went to the renal service, and they did all kinds of work up for him. He had a history of substance abuse, injection substance abuse, unfortunately, and cut it with talcum powder that blocked up his veins and therefore destroyed his kidneys. He was a worker, he's a sex worker, but he was only 21. And the way the doctors did it was they had grand rounds, and people came in and they stand around the bed and they look at you, and they're exchanging information about his health condition. And then they said, His kidneys are shot. He's going to go on dialysis. He's got AIDS. She'll take care of you. And they walked out of the room. And the young man said, what did they just say? That's when I knew that this is going to be a problem, because the idea of having to explain not only what dialysis was and what's that going to do to his life, but helping him understand what it meant to have AIDS at a time when there was no medication available. And I realized then that that's pretty much the way it was going to go, that unfortunately people of color, black people, were just going to get enough information that they wouldn't understand necessarily if it is not explained according to what their life is actually like. And we already have fear of hospitals. My grandmother used to talk about the black pill that to watch out for when you go to the hospital, because that meant you was going to die. And so we hadn't then gotten much past that. So we had a conversation, and he went on dialysis, and within 6 months he had passed away. And unfortunately, it continued to go that way. Now, I'll be honest, I didn't know a lot about the social political issues of the gay community. I thought it was enough if you were gay in a society where that's not allowed, it's not acceptable. But to witness the discrimination that was occurring in the midst of this incredible epidemic, that black men who were gay couldn't get information. They weren't able to attend different prevention classes because, well, you're my boyfriend during the day and we can party a little at night, but that's all you are in my life. I couldn't comprehend that. I'm telling you, black gay men will teach you some things, though. Okay. And I sat around and tried to get a full understanding of what exactly that meant, and I said, there is no way that this is going to be taken care of in the way the mainstream is doing. The organizations that were initially funded, Philadelphia AIDS Task Force, now another name, the Mazzoni Center is what it's called now, but they had the money. The Philadelphia Department of Health funded them, and they were supposed to take care of gay men all the way, everybody. And there were people who weren't even acknowledged. And unfortunately, PCHA made a mistake in that they needed to have an African-American woman and a religious minority if possible, and they made me vice president. That was their mistake. And so I joined the board thinking I'm going to be able to influence them into actually thinking about outreach to black gay men. And I knew the clubs, and I knew what kinds of things needed to be said and the kinds of work that needed to be done. And they put it on the agenda at the bottom. And 3 meetings, which meant 3 months later, it was tabled. We'll get to it next time. And I went, no, you won't.
Right.
And so that little clip of speech was the first AIDS walk that was done in the city of Philadelphia. And they had us walk through all of Center City. We had black umbrellas. There were posters carrying the number of people who had died from AIDS who were Philadelphians. The number was 339. And of those that had died in that year, of those, 241 were African American. Now, I know numbers, I can do math, and that's what set me off. I went with the idea that we're going to form this organization, myself and a gentleman by the name of Wesley Anderson, who had been the CDC representative to the Philadelphia Health Department. We got together, and Bebashi came out of the kitchen. It's like, that's what we're going to be. We're going to be blacks, educating blacks about sexual health issues, and we're going to do this. I was very excited about it. We had to put the I on the end because Bebashi sounded like a dance. But at that moment, we knew this is what we were going to do. Wesley went off to do some other things, but by the time we got to the Love Park AIDS walk, I was done. I was done fooling with them. And I apologized to the mother of a young man who was white and gay. She had come because her son had passed, and she wanted to, to honor his memory. He had gotten kicked out of his home and all the things that are often talked about, white gay men. And I apologized to her before I did my speech, because I said to her, I have to say some things that are probably going to sound very painful for you. I apologize, but it must be done. And she said, baby, you go ahead and do whatever you have to do. You say that. And I did. I talked, I mean, the part of the clip that you saw was the gentle part, because there were some words that were said that weren't as gentle as what you heard in the clip. But basically saying, you are not going to kill my people for money. You just aren't going to do it. And so I went to work for the health department and created the AIDS Activities Coordinating Office ultimately, but the AIDS unit was down on Lombard, and the city gave me a contract. 4 days of the week I could work for the health department and say important things about the government in political correct ways. And one day to say what needed to be said for Black people and HIV prevention and education, and they paid me for that. And then it was like, I can only do 9 months in here. You all gonna give birth to my whole life. And so I left the health department, and Bebashi came into full being, well supported by District Council 1199C, gave us space in that wonderful building that they have. And the voices that you heard, one of the important ones was Tyrone Smith, who was a longtime activist in the Black gay community. Sadly, he just recently passed. But he and about 15 Black gay men said, where's your office? Said, we don't have one just yet, but by Friday we will. And we did. And they came and volunteered. Michael Henson was one amongst those who came, and my sons, they were babies, 6 and 4, and they helped write the brochures for Bebashi. You know, you have to do literacy. And so low literacy meant that if a 6-year-old could tell you what the words were, you're in good shape. We were in good shape. And we did outreach, education, you name it, I was there. I never had staff or volunteer go anywhere that I didn't go. So that's what I was saying earlier. I knew the Black Banana and Pentones, you know, all the gay bars that were down in Center City at the time, largely Black gay bars. And that's where we did our outreach. Now, admittedly, people would see, I will never forget the first time they would see me and go, so are you in the right place? And I was like, yes, I'm doing 2 o'clock AIDS education prevention seminar in this place. And it's going to be converted into the dance hall at 6. So I have to get started at 3 o'clock, let's go. And really being able to talk. And people wanted to have, I mean, the guys were like, oh, so, and how you really feel about us? I said, well, you just like my children, you know. I love my children. I love you. Mm-hmm. I want to tell you about this because you need to understand how important this is, not only for your health, but for your partners, for the community, because you represent the talent that we require in order to survive as a people. And we're not selecting you by orientation. Only white people do that. They make you check it off in a little box. I'm not doing that. I just want to know, do you love your people? You have time? And what's your talent? Bring your talent, whatever it is. If you can fold papers in straight lines, we got some brochures that need to be folded, you know, all of those kinds of things. And so Bebashi was born out of that. And every time a new issue came up, Bebashi was on the forefront of it. When there was concerns about women and HIV and the impact that they were experiencing in terms of cancer, ovarian and uterine cancer, when they talked about the babies that were dying and not having anyone willing to take them on, we created those programs, as you have continued to do. But that's really what it meant. People were dying quickly. In the last 40 years, the thing that has been most painful for me is having to attend funerals of people that I worked with, who work with me, who helped build Bebashi, who helped build the National Minority AIDS Council, of which Bebashi is a founding member. And we help minority organizations across the country develop their programs in order to know how to do that kind of outreach. And they're gone. It just is, it's amazing to me to actually see the loss. I went to the Black Gay Pride kickoff event, and I know 2 people here But the founders of those were my children. They were my sons who were really active, who created Colors and some of the other organizations. But I didn't stop with that. Bebashi is a founding member of creating Congresos programs. So they have a program called Esfuerzo for women and their children to receive HIV education. That came from Bebashi. The Asian community, we don't talk about that, but you multiply real good. So somebody's having sex. Let's talk about how that's going to happen. I never try to tell people, as we don't now. I'm gonna tell you that you can't do something. I want to tell you how to do what you do better than that, safer than that, so that you can survive. That's always been our place. It's always been our place.
How was the city's response to the epidemic?
Oh. Well, the city, like the nation, really didn't know what to do. You know, the politics around it was homosexuality is not acceptable. And I honestly did not realize the depth of that. I'm like, wait, there's 4 gay men right here. They're on special committees. They are commissioners of something or another. What do you mean? Well, you mean you have to hide. Mm-hmm. Oh, we not hiding. We can't hide. And there was a lot of that. There was a lot of fuss and arguments. Probably the greatest documentation is PGN, the Philadelphia Gay News, documented this idea of this covered Muslim woman coming in telling us how we should deal with the money and working in there in the health department and everybody going, and are you talking about sex? Or even in my own Muslim community going, and you're talking about sex publicly, we cannot have that. Well, I don't know where you're going, but I am going to talk about it. And then the first Muslims from prison who went there because of substance abuse and the lifestyle they didn't talk about. Mm-hmm. Well, you have to come and talk about them. How are we going to bury these people? I had talked to funeral directors, you know, they bury people all the time. They don't know what people had. How are you going to talk about we have to cover them in plastic or they can only be cremated? And no, we're not doing that either. You drain it the same way, you know, you're going to treat everybody the same. And so every step of the way, if you could think of some human contact that needed to happen, somebody had to go and say, no, we're not doing it that way. Our people are not going to content to just say, oh, we're going to cremate people. We're not doing that. If that's their choice, okay, but you're not doing it because you think AIDS is airborne. You can't tell me that a Muslim can't come and sit on a carpet because they have HIV. What are you talking about? And so all of those things happened every day, so that my whole life has been around prevention, talking to people honestly about it, black gay men coming and saying, well, Sister Rashidah, what about? They used to laugh at me so much in the CDC meetings because I would go to Atlanta and have a good time, but sit in those meetings and I would in the hotel lobby and people would come and you'd see them sitting on the floor. It made me feel like a queen. But they're asking questions about how should we be able to present this information? How do you talk to the government? The government is what it is. It's a bureaucracy. We as community members represent the collateral development of what needs to be done. So for me, it was just give us the money. Here's what we're going to do with it. And then we do it every day. I went out on Broad and Girard and talked to the folks who were sex workers, wore my hat, my scarf tied to the back. I had jeans with studs down the side, you know, and sat on the wall and talked about prices. I have condoms. Here's a string of condoms. She said, but we can't do business if we have to use condoms. Say, oh, yeah, you can. You tell them if you don't let condoms be a part of this transaction, you have to charge them more. They were like, oh, can we do? Yeah, you can do that. Yes, you can. And then it comes, well, then what do we do about STDs? And I'm so proud that you all test routinely for STDs, but knowing that syphilis increased and babies were being born with syphilis, congenital syphilis, because people weren't accessing health care. So then we have to go, okay, well, that can't be happening. What's scary to me today is the rates of syphilis are going up again. The incidence of gonorrhea and chlamydia going up again. Well, does that mean? That means that nobody's talking about safer sex. I don't know how many different ways you can say that. People dying from diseases thinking that, well, we have medication, I can get penicillin, or I can get the once every 3-month drug, injections, am I eligible for it? No, because we don't have that kind of money. But being able to keep pushing the boundaries, the health department was not interested in doing that, and they made it all so that initially only the health center at Broad and Lombard was the only place you could go to get HIV tested in the public sphere. And so, again, spreading out the idea of we got to have testing available in any way. University of Penn gave up their mobile units so that we could do testing in the community. Those kinds of things have always been the barrier. And we've always had to come around and say, no, this is how we have to do it. We need to have the van from midnight to 4 a.m. because the people most at risk are in the street at that time, and we got to be there with them. And yes, we will be charging buckets of chicken to the grant, because we know we don't talk to people if there's not some kind of treat involved. And so we're going to have that. So all of those kinds of things always came into it. The health department accepted that, begrudgingly, but they accepted it because the whole idea was we've got to do something about the spread of the epidemic.
What did you learn about the community in the early days of your work, and did you consider yourself an ally then?
I didn't know I was an ally because I didn't know what that was. What I know now is, yes, allyship is critical. I will say that right from the beginning. What I did learn probably more than anything was the discrimination I hadn't anticipated. Even being an ally, there were moments where it was said to me like, well, what do you know about what happens to us? You don't know how it is, how it really is. Well, then tell me how it is, and I'll tell you how we can make a difference. Because that is the part, if nothing else, that I learned, that honesty is critical in talking to people, being able to say, this is how I feel. Yes, I am Muslim. Yes, there are words in the Quran that are very specific, but if you turn the page, it says that God created everyone. So there's no special place for anybody. You take whatever special issues you have, that's on your side. My responsibility as a human being knowledgeable is to share the gift that I was given, and that is to be able to educate people in an honest way. Being open and honest, truthful and consistent. That's really what made the difference. And that's what I've tried to do. That's what I still try to do, remain in that way.
How did your faith and identity as a Black Muslim woman shape your advocacy during a time of fear, stigma, and neglect?
Well, there was a moment where the Council of Imams of Philadelphia spoke to my husband at the time and said, you have got to sit her down. They were very intense, and he said, well, obviously, you don't know who she is. And so there was no way for them to do it. It did take me 15 years to get them, the Council of Imams, to change the marriage counseling that was going on, the premarital counseling that they were supposed to do, because people would come in on Friday morning. Now you have to know Friday is a big deal. That is our faith day in the Muslim community. And so you get married on Friday, that's like special. So they come in the morning. Nobody knows you from a can of paint. You just say you want to get married, and the imams would marry you right after Jummah, right after the service. I was like, no, you can't do that. Because people need to know their health status, not just whether they're HIV positive or whether they have an STD, but you want to know about some of the other history that we carry. Heart disease, hypertension, diabetes, all of that. So you have to stop, you have to get at least 3 counseling sessions done over 3 weeks. They were like, oh my God, what should we be doing? That's not right, they'll have sex. Oh, wait now. Are you saying that you don't think they should wait just a minute before they indulge until they know a little bit about each other? Sister Rashidah, you don't understand how it is. Yes, I do. I know exactly how it is. And what I know is you're not being honest. You're not being honest. Let's acknowledge who we are as human beings. We enjoy ourselves, all of our pleasures, regardless of where they are. We indulge. So let's make it better for people, that they have the information, that they have the dialogue that says, yes, I have had 50 partners. And I'm healthy, but, there's certain things I have to have. And then, man, we're going, oh, my God, are you going to talk to them like that? Yes, I am. Yes, I am. Yes, I'm going to prison, and I'm going to talk to all these recent converts from, we've been in the street and we sell drugs and, whatever else lifestyles you're involved in, and don't come to the community and pretend you're something else. I have been Muslim for 56 years. I don't think there's anything that would change that. So I'm going to talk to them just like that. I don't care about what you do. I want to tell you how to do what you do better, different, educated, protected. And that's whatever it is. It could be HIV, but it could be diabetes. Leave that donut, that Pepsi or Coke on the side.
Or chicken wings from the Chinese store.
Oh, chicken.
Ooh, I love me some chicken wings,
Now, we'll
Dr.
say
Rashidah.
that is a bit of a struggle, but I'll tell you how to indulge just once a month, okay? That's all you. But being able to be honest with that, to help people acknowledge the challenges that they are confronting, with it. So my faith is tight because I believe that my assignment was an ally, but also a mom. I am Umi to many people in the community, mother. That's who I am.
Absolutely. And in a 2004 African American AIDS Oral History Project, you mentioned being pushed out of mainstream response to HIV. What kept you going, Dr. Rashidah?
Well, as I say, it was my God-given assignment, so I really didn't care very much about being pushed out. There was always an attempt to do that, but I had good friends and allies. One of my strongest allies actually was David Fair. I don't know if people know David Fair. He was the Secretary-Treasurer of 1199C. Ultimately, we collaborated on the proposal to create the AIDS Activities Coordinating Office. But David was fiery. And so we would go into meetings, and he would act a fool. He would bang on tables and say just incredible things about these people, and you're killing, and they would go, oh God, David's coming. And then they go, Rashidah. And we had already collaborated the night before, so I'm coming in, I'm the good cop. And so being able to come in again, knowing very well what needed to be said, and if you remind people that you're killing us, they tend to go, well, what do you want? And I go, well, unfurl a list, just unfurl the list of this. We want this. We want to have money for presentations. We don't want to be restricted about how we can bring people together to have these discussions. We don't want to be limited to what we can say in brochures, because that was a big thing then. You couldn't say things explicitly. Is it now still? We wanted to be able to do advertising and really be able to encourage people to step forward, going across the country in minority communities, talking to their leadership, their pastors. That helped me a lot, because these are men of faith. They were men of religion. They had to demonstrate their faith, especially to me, because I'm going to call you out on it. I know the books, all of them, the Bible, the Torah. I can talk to everybody with it and help them understand. You just do what you have to do. Push the door open. Kick the door open. Kick the door down. Whatever you really need to do. Because when you think about it, what's the absolute worst thing that could happen? They could kill you. Okay. Can't do anything God didn't intend. So, here we go.
Can I get an amen?
Amen. Amen.
That is part one. Let's give Dr. Rashidah a round of applause. As we move into part two, carrying the torch with this lovely lady sitting to my left, a vision of love, a vision of red, Miss Sebrina Tate's leadership today. Sebrina, as the current CEO and president of Bebashi, what does it mean to carry forward this legacy in 2025?
Ooh, what does it mean? We are still challenged.
Yes.
It feels like we've stepped into like a time warp because we've come so far, or we came so far, and we find ourselves being censored still. And we toe the line with how we do what we do and get money to do what we do, because the people who had the money before still have the money.
Yes, they do.
Yeah. So people continue to give the money to the Mazzonis, and they give them to the larger organizations who are not traditionally black serving organizations, but we find a way. And just like you, we go out in the middle of the night. Now we have our own mobile unit, so we don't have to use someone else's. Although ours, you know, you got to kick and turn it and knock 3 times on the door to get it going. That's a real thing. But I feel like this is my calling too, and a lot of what you said, it just sits in me. A lot of what we do, we think about paying homage to all that you've done and making sure that we further the mission. We are just honored to do the work. And again, ally, I don't know if that's a real thing. I mean, maybe that's how it's seen, but I'm like, it's just what I'm supposed to do. I don't know that I do anything else. So I'm just honored more than anything.
Bebashi's work has grown beyond HIV. What are the biggest challenges facing the Black LGBTQ plus community and the larger Philadelphia community, Sebrina?
Well, right now it's funding, because not just in the LGBTQ community, but if you're talking about black leadership, I belong to a group called BNCEP. It's Black Nonprofit Chief Executives of Philadelphia. And we did some research on how money is funneled, right? What we find is that black-led organizations, particularly those that are black serving, right, are charged with doing the same work that other organizations are charged with, but we're charged with doing it with less money. So you have fewer resources, you have less money, sometimes what people consider uneducated staff, and the charge is you still have to have these outcomes. You still have to meet these goals. And so you find yourself saying, you know what, and we're going to find a way and we're going to do it. But it is becoming increasingly difficult with the current administration to continue to do that. Philanthropy is down in Philadelphia, and unfortunately people don't write checks to places like Bebashi. We get little to nothing in terms of support, so we just find a way to keep on doing the good thing that we do, and hope that we touch enough people that say, you know what, I don't have a whole lot, but I'm going to give $5 and leave it in the bucket in the front, or I'm going to, when I get a little extra something on my income tax, I'm going to give it to a place that I know gives it back to people like me, whether it's uninsured individuals or individuals who want some level of anonymity, or people who just have more money than they have money and they need something to eat. When they get it, they come back and they give it, and that's how we, you know, remain in the space that we're in.
You guys are the best. You know, I have a lot of love for Bebashi. Thank you for all you do for the community. I want to make sure I salute y'all on that.
Yeah, I'm going to say I can't do it by myself, right? And it takes a whole lot of trust from people that if I don't belong to a particular group or a particular community who say, I trust you implicitly, like to be sure that you're doing the thing that is best for me. And I just have the most awesome team of folks who are like, I don't know what you talking about, but we're gonna do it anyway. I'm like, just trust me, we're gonna get there. We're gonna, and we wind up doing what you did. Like, we find ourselves in these spaces where we're not supposed to be controversial, but I look out and they're like, do it. And I'm like, you got me if I mess it all up. And they like, got you. And we just say the things that are unpopular. You know, we say the things that like, hey, we talk about monkeypox, we talk about all these things, because, I mean, whether it's COVID, whether it's monkeypox, whether it's, HIV wasn't the last.
Not
It
at all.
continues, and the disparities impact us. That's who it impacts. And we find ourselves in these spaces where Bebashi was open during COVID. I talk about those times all the time because I remember people saying, you putting us at risk by making us come to work. And I'm like, people need to remain virally suppressed. So you got a choice to make. You can come in here with me and make sure that people get their medication, they get food, and that they have a warm place to be. Or you can sit at home and, find, you can get unemployment. It was an option. But we gonna serve, and our doors are gonna be open every single day. And the people who stayed saw the vision. They were like, we're gonna do it. Unfortunately, we did. We got COVID. There were people who got really, really sick. And there were people who saw the loss of their loved ones in that process, but they understood that it's larger than you. And so when you have faith and you're like, I know I'm doing God's work. If it's meant for me to go doing this, then that's what's gonna happen. The same was true with monkeypox. Like, people were like, oh my gosh, here we go again. We don't want to touch. And I'm like, and we will. And we have to talk to the people and say, you keep on giving this vaccination to everybody else. You keep on giving the resources to everybody else. You're saying to me that, the people who are impacted by monkeypox are black men who sleep with men. And everybody else has this vaccination but us. Help me understand it. Like, help me understand why you continue to say, oh no, this is about, addressing diversity and making sure that there's equity, but we don't have access. Who else does it better than Bebashi? I want you to tell me that. We had it by Monday. We had the vaccination by Monday. And the numbers plummeted immediately. Like, immediately. Because we were at Level Up, and we were at the clubs, and we were out at night, and we were like, if this is what you need, and we're going to say to you, we're not making you take it, right? Because it's a vaccination, and people still feel a way about it. But if you want access, we're going to make sure that we get that access. But it's a challenge. Because, again, you got to fight for it. They don't give you the same amount of money that they give other people to give it. And then, we like, all right, you can't drink and get the vaccination, but we're going to give you a coupon to come next week and have a drink. You know what I mean? We're going to figure it out. So the chicken wing or a little cocktail, we just want to make sure that you're in a safe space and that you're as protected as you can be.
You recently opened a new space that I have to visit.
It is beautiful.
Can you tell me all about Bebashi's new Woodland Avenue Center, and what does that expansion symbolize for the organization and the community?
So we moved from 12th and Spring Garden. I think we were there, 20-some, 30 years. We were there for a very, very long time. And it served its purpose. We expanded from one part of the building to the other, and downstairs, the garden level. It's not the basement, it's the garden level. And we opened up our own wellness center. So we had a clinic. We opened that about 4 years ago next door, and we just were growing so much. And so, again, working through COVID and working through monkeypox and saving up our coins and having folks say, well, we can't get raises and this raise is not enough and we should be paid more. And I'm like, I'm working to do all those things while simultaneously trying to build out a space that we deserve. Not just the staff, because of course they deserve it. They work through all of those things. But for the community, they deserve the space. Mazzoni has space. Why shouldn't we? So, my staff was not happy with me, but I was like, I'm going to go over there and I'm going to build a space. And I want you to trust me that it's going to be intentional. It's going to have you in mind. It's going to have, the people that we serve in mind. So we have what I call Bebashi Joe's, kind of like Trader Joe's. But it is a food pantry of choice. And it is just beautiful. It's like a local bodega. You get to go shopping. It's like a supermarket in our building. And, you shop for the foods that you eat. So if you're vegan, then you get jackfruit. And if you are pescatarian, then you get fish. If you are, a vegetarian, whatever your palate is, we have something for you. And you get to shop. You have a dignified experience. And there's less food waste. So that's just one component of what we have. We have a boutique that was birthed out of our trans necessity closet. with gender affirming items. Those things still exist, but we saw that there was such a need for clothing, particularly, for people going on interviews or having to go somewhere. People go to funerals and like, I don't have a suit to wear. We have a boutique that has professional attire, it has everyday attire, and we've opened it up to anybody who needs clothing. We're hoping to expand it to children because we have children who come into the organization that just don't have clothes to wear to school. Of course, we have our flagship programs, case management and prevention navigation services. They continue to be strong, but we have our pharmacy. We're hoping to have our own pharmacy soon. There's a lot going on at Bebashi. One of our newest programs is a housing program. They give out money to all these organizations for housing, and I'm like, there are people who are HIV positive that need housing too. Let's figure out how we get some of those funds. And like I said, my staff is like, if you say that's what we're gonna do, we're behind you 100%, and they make it happen. So that's just a slither of the things that we do, because we've got a gym for our staff, because I believe, like you believe, that wellness is the total person. It's the total package. So we have a Zen room for people to just go and be able to have a Zen moment or pray. During Ramadan, this is your space. Yes, it's a great place that you should come to visit.
I'm coming.
Okay.
Trust me.
Got that, Michael? Okay.
Give it up for Sebrina Tate, the current CEO and president of Bebashi. Hope you guys are enjoying this powerful conversation. We are moving into part 3, looking forward. What does legacy look like now? What does allyship mean in today's climate? I'll start with Sebrina.
So I'm going to speak from my perspective. There's a privilege that comes with being straight, right? Just like there's a privilege that comes with being white. And so for me, allyship means saying your name in a room full of opportunities, right? So if there's an opportunity to have you be safer and healthier, I'm gonna make sure that your name is said in that room. I know what it is to have that privilege. I didn't before, because I was like, I'm a black woman, what does privilege look like? But it looks like that. It looks like when you have the stage and the audience, making sure that those opportunities are made available to the people that you care about.
Dr. Rashidah?
I think that we are once again at a crossroad, just as you said, where the condition of society right now is such a wreck, so much animosity. But I think that we have come to a place where we have an opportunity as a people to do something a little bit different. I'm really clear, nobody marching. We're not marching nowhere. We're not doing that. I am fascinated by this current status where they say DEI and people out in the street protesting, and they go, where's the black people? And they go, been there, did that, and have the T-shirt. We are not going to do that again. But what we will do is we will circulate the money in our own community. I was so excited that I was able to buy something called a black box. It's black produced products in a black box. And I thought, I can do this. I can give some money. I have some money.
We appreciate you.
I have some money, and I've been trying to give it for a minute, but haven't worked out yet. But I have the money. And when I die, you have some money. So it's like all of that.
I love
but
it.
That is what I'm saying, the kinds of things that we have to now think about. We have to articulate that there are things that we can do to be supportive of the community. Allyship does mean something a little different, I think, now than maybe it did a year or 2 or 3 ago. It is not just we're willing to talk about LGBTQ issues. It is we are putting the issues in the context of saving our own lives. And so, yes, I will be an ally now, but now I'm going to allow them to know what an ally actually is. When we say, no, we're not doing that. what we are going to do is this. We're going to support this. We're going to give to this. We're going to provide this kind of information. You don't have to teach Black history in your schools. We will teach Black history. You don't have to worry about preschool education when you take money away from Head Start. We have our own daycare centers. We will teach that. We have people who are willing to volunteer to do things, whatever, once again, whatever your talent is, the community is now in need of it. So if you are upset because you didn't get to exhibit your fabulous artwork in some well-known gallery, okay, we have space. We can exhibit it, and we will have a nice art opportunity. We'll sell your art, and we'll take a little piece for the community. We have to now think of the things that we used to do for them that we now can do for ourselves. So for me, that is the future. That is what the legacy says. I promise you, I didn't march in 1960 anything, but I did learn how to use a gun. And then the revolution didn't come the way I thought. And now we're back to that. So I am fully prepared for the revolution. Might not need a gun, but I'll be in the room for you.
Let's go, Dr. Rashidah.
Yeah, just come
the
with
revolution will be televised.
It will be televised, absolutely.
What lessons can current movements learn from the Bebashi's grassroots efforts in the 80s? Sebrina.
No, I guess trust your gut. I mean, I'm a Christian.
Alhamdulillah.
Converted to Christianity. That's another story.
Wait, so we won't talk about
But grow not weary in your well-doing. Because people will come for you. And people will question, like they did with you. You're a Muslim woman. You know, you're a straight woman. You know, why do you even
Surround
care?
yourself with
Why
those boys.
Do you really care?
Right, yes. Yeah.
But if you stick with it and you just go with your gut, there will be those who are behind you that are like, I trust. And patience is like an easy thing to say, but a hard thing to really like enact. And so I like to go to the gym. My people tell you all the time, I love to go to the gym. It's a thing. And you go to the gym, you don't see your muscles, right? You're like, where are my abs? I've been here for a week. Where are my abs? I've been here for a month. Is that a piece of ab? Like, it takes time. And so sometimes working on something you don't see the result of and just trusting that one day you're going to see that thing is what I would say to folks who are trying to do something that they love, that they're passionate about, particularly when it comes to saving lives. You know, when you know that it has to do with our people, just continuing to stay in that vein is the advice that I give, I think. Yeah.
Well, I must say thank you, Dr. Rashidah. Thank you, Sebrina Tate. We appreciate every single thing that you have done and that you will continue to do in this community. Can we get a round of applause? And thank you to Philly Black Pride for this amazing event. This was simply the best.